The National Union of Public Service and Allied Workers is demonstrating outside the Gauteng Health Department offices. Members want community health workers and those who are part of government's expanded public works program to be made permanent staff. The department announced that it would be terminating contract workers, including doctors and nurses, despite the shortages in health facilities. Unions want to challenge the decision to terminate the contracts of 800 health workers recruited at the height of the COVID-19 pandemic. The members have threatened to intensify their strike action if their demands are not met. eNCA Silindelo Masikane has more on the story and joins us yet again. Silindelo, what's the situation now?
Well, things have calmed down outside the Gauteng Health Department. Workers affiliated to NUPSO are making their way home now, and this is after 2 days of demonstrating and sleeping outside the Gauteng Health Department, raising their concerns and frustrations around the fact that many of them will be without jobs come the 31st of March because their fixed-term contracts are coming to an end, and the department has indicated that it does not have any intentions of renewing those contracts. But we had an opportunity earlier to speak to the General Secretary of the union with regards to the protest action and what they plan to do if their demands are not met. Let's take a listen.
Job is important to us because we have families. Some of us have degrees, but it is hard in South Africa to find a job. We have been servicing the Department of Health for 5-10 years, and now they are telling us that the contract is ending. So when we're supposed to go after servicing our communities and hospitals and the health department as a whole for 5 years and 10 years, and as you all know, that the age group now for hiring people is 18 to 35 years old. And some people here are over the age of 35 years old. So we ask the Department of Health to please absorb us permanently, because we have been doing a great job and we have been working for the Department of Health for long. So we are asking the Department of Health to please absorb us permanently, because we have been servicing them with the spirit of excellence. So that is what we are asking. And here we also have uncontracted CHWs who have also been servicing the Department of Health. So we are saying now, it is enough. We also want to feed our families. We also want to contribute for our families. We also have dreams. Some of us went to university. So can they please absorb us permanently? We have been working hard.
You know, Silindelo, the extent of the desperation can be heard there. What more do they have to say around this?
I mean, you can hear, of course, from that clip that, you know, these workers really need their jobs. Many South Africans at this point really need any kind of income that they can get to feed their families. We know that the socioeconomic conditions of many South Africans are in dire straits. In fact, a recent report by the World Bank says that South Africa is the most unequal country in the world. And so, I mean, it doesn't surprise any of us to see that anyone who's told that they're going to have their jobs taken away from them is going to be desperate enough to come and sleep outside the department's offices. But let's just take a listen to what the General Secretary of NUPSO had to say. All right, so we don't have that clip at the moment, but what we understand is, of course, that the union says that they are planning to try and have a sit-down with the Department of Health next week, Tuesday, and if those negotiations don't go well, we are, of course, expecting to see intensified protest action from the members of NUPSO.
All right. Silindelo, thank you very much for that update. That's our reporter, Silindelo Masikane.